I was born and raised in Argentina, so my native language is Spanish. And when I was a graduating student at the University of Chicago, my first job was at a community mental health center that was for many different immigrant groups, but primarily Latinos. It was in a Latino neighborhood. It's called Pilsen Community Mental Health Center. And during the time that I worked there, I was very much in demand. It was the 70s, very few people spoke Spanish. So I was what today might be called a culturally sensitive and bilingual therapist, automatically by where I was from. And during that time, I became very interested in family therapy. So I went to get training and remained to do clinical practice at the Institute for Juvenile Research Family Systems Program in Chicago. And there I saw many families, many impoverished families, many minority clients, white, African Americans, and Latinos, and increasingly questioned the theories that I had been learning as being very much tied to one specific dominant group, dominant in terms of race, class, religion. So it was very much the beginning of family therapy was tied to the 1950s families of television, So white Protestant, two kids in the family, mother that stayed at home and father that worked. So it was much of social science used that as the standard model family. And I knew through my own experience and through the families I was working with that there are many ways to have healthy families. But that there are different ways of organizing it, different ways, the meanings of the life cycle, how people transition, the kind of rituals they use, the kinds of decisions about when young people leave home. So I wanted to begin honoring those knowledges that people have that are more local and more circumstances of people that are not usually being studied.